Welcome to Say Yes to Chocolate, the podcast where better is the goal, not perfect.
We're your hosts, Dr. Becky and Sara B, bringing you simple, science-backed wellness with a side of real life and a sprinkle of chocolate love, because balance should taste like joy.
If you're ready to simplify your health and thrive in your 40s, 50s, and beyond, you're in the right place. Let's do this.
Welcome back to Say Yes to Chocolate, episode number 3, the podcast where better is the goal and chocolate is always allowed. I'm Sara B.
And I'm Dr. Becky. Today we're diving into something that confuses a lot of women, Sara. Even those already doing all the right things for their health, and that's bone scans.
Specifically, we're going to talk about the difference between the traditional DEXA scan and the newer, less known REMS scan, otherwise a Nicolite, and why it really matters in which one or when you get them.
Absolutely. It's really exciting with the newer technologies, but I think most women over 50 or possibly 40, I mean, if we're providers are starting to talk about it now, but most women over 50 are familiar with what's called a DEXA scan. It's been the gold standard for diagnosing bone disease or thinning bones, osteopenia, osteoporosis, for decades now.
Since the 80s, right?
Like late 80s, early 90s. Yeah. It uses low-dose X-ray technology, so it's actually an X-ray beam to measure bone mineral density. And that bone mineral density is then translated into what's called a T-score, and that's what's used to ultimately diagnose. But most of the time, bone density is measured in the lumbar spine and then in both of our hips. Unless a hip has been replaced, then we don't measure a hip. But those are the two kind of key load-bearing, weight-bearing areas of the body that are measured in a DEXA scan.
But we only do this lumbar spine. So the lumbar spine is the lower 5. The lower 5.
Yep.
And then the 2 hips.
Yes.
And in that you get a total hip and then also a femoral neck.
Yes.
And the femoral neck,
and
because that's a little bit confusing,
yes.
right? Like it's not actually our neck, it's actually the little bone.
Right. So if you envision, let's see, if you're on YouTube, I'm going to try to demonstrate.
We're demonstrating the hip with our hands.
So I have my hand, I have a fist. So the fist of my hand is basically like the ball and socket of the hip. And then where my wrist...
On this side so they can see you.
Yes.
This wrist here.
My wrist bends essentially is what's called the femoral neck. So that is measured because that is the most common area for a hip to fracture. So it is not our neck. No, this is called cervical and this is femoral neck. So.
And a fracture in the femoral neck is very life altering for especially women over 50.
For sure, yeah.
So, and it's the tiny bone, but it's connecting your upper and lower body together. So that small bone is so important to our bodies.
Well, yeah, and I mean, the spine and the 2 hips are the reason that we measure in a DEXA scan because really the only thing we're concerned about is fracture. And really at the end of the day, we're concerned about what kind of implications that fracture has on our overall health. So spinal fractures can be devastating. They usually lead to chronic pain, lack of mobility, the ability to be independent, but hip fractures are even more so. I think somewhere in the realm of 50% of all hip fractures, people will never regain full independence.
Right.
And then a quarter of all hip fractures lead to all cause mortality within a year. So that's scary. That's terrifying.
Very scary.
And so that's the reason that we measure those 2 areas.
Sure. But then we aren't worried about like the calf bone because I don't actually know what that calf bone is called.
The tibia. No, we're not necessarily worried about the tibia.
We're not worried about our toe bones. We're not necessarily worried about our fingers or...
No.
So, but really just the weight-bearing areas.
Correct. You can get an idea of what the other bones of the body or the health status in those bones of the body based on the DEXA results from the spine and the hip. But if you fracture like a wrist or an ankle, they're not as life-altering, if you will, as fracturing in the spine or a hip.
Sure.
Most people make a full recovery.
Right. We still don't want you to fracture there,
but
it's not as serious.
Correct.
And then also, when we're talking about a T-score...
Yeah.
So we're going to go into a deep dive of T-score next week. I'm so excited about that. I love T-scores.
T-scores are Sarah's love language.
They are my love language.
So, yeah.
Full out nerd moment.
Yes.
But what exactly is a T-score? Let's just hit that because that is what you're getting out of that DEXA scan and the next scan we're going to talk about as well.
Correct. And a T-score is also what's used to diagnose. When you have a DEXA scan or a bone scan in general, we get raw data called a bone mineral density. That bone mineral density is then translated into a T-score. And that T-score essentially is a score that compares your bone density with the bone density of an average 30-year-old.
Okay.
And the reason we do that is because this is probably going to shock a few people, but it's because we technically reach peak bone mass at about the age of 30.
Yeah.
Then for about a decade or maybe two, we maintain that peak bone mass, and then going through menopause and estrogen decline and all of the things that come with that is when we start to lose bone mass, bone density. So your T-score is essentially comparing where you're at now at your age with where a healthy 30-year-old is considered normal. So it's a standard deviation from normal, essentially.
Okay. And that's where we get the diagnosis of,
yes.
Well, we don't really, of thinning bones, the start of osteopenia
yes.
and or osteoporosis.
Yep. So we're going to get normal, thinning bones, or a diagnosis of bone disease.
Okay. That is the gold standard in the U.S. So why are we even having this conversation?
As far as the DEXA is the gold standard, so
yes.
why are we having this conversation? Yep. Because DEXA has some real limitations, and we now have some emerging technology that gives us more precise and potentially more useful data about your overall bone health and bone strength.
So let's go ahead and just start talking about where the DEXA falls short. It is the gold standard in what we have here, but there is definitely PubMed research telling us that there is some things about it that aren't great. And what are those?
Right, there's some challenges for sure.
There's some challenges.
So let's start with the big one. If you listened to last week's episode, it was all about quality versus density and giving us a much better picture of overall bone strength and fracture resistance. DEXA scan only measures density. It doesn't tell us anything about bone quality. Bone quality is what we need to know so that we know how well our bones are going to absorb shock, how elastic they are, how fracture resistant they are, and give us much more of a real life picture of our risk and or not.
And one thing too with the DEXA scan is it really is giving us, it's just telling us at some point since we've had a DEXA scan, or if it's our first one at some point in our life, we've had bone loss. It doesn't actually tell us if we're in active bone loss right now.
Oh, correct.
But if we're talking about it looking at the density, that means that I could have brittle bones, but I could have a good T-score because I have a dense shell. So you could have a really dense bone, but still be brittle on the inside, and the DEXA scan isn't going to pick that up.
Correct.
Okay.
Yeah, that's one of the limitations there. And of course, if it's a brittle bone, it doesn't matter how dense it is, it's going to be much more prone to fracture.
So the other crazy thing too is that you could have a really bad T-score, but not have brittle and have really healthy bone and actually have a low fracture risk and still be terrified to be doing life or be diagnosed or have put on a path that doesn't actually fit what your bone quality is.
Correct. So yeah, that's the flip side, right? You can have really dense but brittle bones that are much more fracture prone, or you can have thinner bones, but they're healthy and they're elastic and very flexible and have an ability to absorb shock, but a very bad T-score. And typically, if you have a very bad T-score, it's terrifying. And most people are going to be given lifestyle modifications. And we've talked to many people that are terrified and they are scared to even, do life. They sit in their recliner.
Yes. So
a couple of the other challenges with the DEXA scan is in order for us to compare scans, it has to be done on the exact same equipment as the previous DEXA scan. So if you get your first one, it's great. And that's, again, just a snippet in time. It's data. Potentially gives us a fracture risk. Bone remodels very, very slowly. So with a DEXA scan, in order for us to pick up a measurable difference to monitor any interventions or how well we're aging, you can only do a DEXA scan about every 2 to 3 years. So there's a big time span in between DEXA scans. And then your subsequent DEXA scans all have to be done on the same piece of equipment. So if you move, then you're essentially starting over.
Well, if you move or your healthcare provider, which we have no
Correct.
control over, updates, changes with locations, just closes the clinic, which we've seen recently.
Correct.
There's no good way to actually compare those DEXA scans to each other.
Correct. That's a challenge right there with the DEXA scan. And then I think the other probably biggest challenge with the DEXA scan is just a brief overview. Again, it's X-ray technology. So it's literally an X-ray beam. So it's like taking a picture. And so your positioning on that piece of equipment is incredibly important. And that is where your lab tech comes in. So the technician actually doing the DEXA scan is really important. And there's a pretty significant margin of error if you don't have the same scanner, scan over scan, and remember, it's every 2 to 3 years. And so if there's new employees or if it just happens to be a different scanner, there's potential for error there as well.
Yes. We talked a lot about the pitfalls of DEXA scans,
Yes.
but DEXA scans still in the U.S. are the gold standard. They
Yes.
still play a role in our full bone quality
Oh,
picture.
for sure.
They're still a valuable tool, but it's not the only tool anymore.
And you just need to be educated. You
Yes.
just need to be informed. And I think that's the purpose of this. And the fact that technology is ever evolving. We're constantly changing and having new things emerging. And one of the most exciting things in the bone health world is new technology called REMS, or echo light also.
Okay. And we're going to refer to it as REMS, correct? Because that is because that's the actual technology the scan uses is actually the REMS. So let's go ahead and dive into it. Let's talk about it. We're pretty thrilled about the new technology, actually.
So REMS utilizes ultrasound technology. So instead of just an X-ray beam taking a 2-dimensional picture like a DEXA, REMS actually uses ultrasound technology, which is more sonographic, if you will. So it gives us a 3D image of the structure being visualized. Everybody is familiar with ultrasounds as far as obviously pregnancy ultrasounds, or if you've ever had ultrasounds to look for gallstones or kidney stones or anything of that nature. It's exactly the same thing. It's just an ultrasound used to actually look at bone.
Okay. That is measuring something different than just a DEXA scan. So is it measuring more than just the outside of the bone?
Yes.
What are we looking at here?
So because it gives us a 3D image and that ultrasound actually penetrates into the bone tissue, we get both the cortical bone, the outside of the bone shell, which is what gives us the bone density. It's the same thing DEXA is measuring, the X-ray beam is measuring. So we get a T-score from a REMS scan. But it also has the ability to look at the inside of the bone, that microarchitecture or that trabecular part of the bone. And that is the bony matrix that tells us bone quality or how elastic, flexible, healthy the inside of the bone is. So we get both.
Well, that sounds super useful.
Yes.
It just sounds like a great way to have a bigger picture of what your bone health is and what that bone strength is.
It's a more complete picture, yes.
Is there any downside to the REMS?
So just like with a DEXA scan, obviously you need to have a trained ultrasound technician. But because we're using, if you're on YouTube, we're using kind of a spray with the ultrasound, if you will. If you could envision radar, and every radar ping is like a triangle, if you will. There's pinpoint and then it flows out. That's what ultrasound is. So it's much less technician dependent. Obviously still needs to be a trained technician. They still need to know anatomy and where they're at in the body, but it covers a much larger area. So it's not just a 2-dimensional image. There is a little bit more reliability in that.
Sure.
And then because it is just ultrasound technology, it literally is just, as long as it's an ultrasound machine that's capable of evaluating bone, it doesn't have to be the same piece of equipment either.
Okay. So you compare them, which really helps a lot.
It helps
I think in the US right now, the hardest part is there just isn't as many locations.
Right.
It's just, it's totally FDA approved.
It's been FDA approved. It's been used in Europe. It's actually, there's a few countries in Europe now where the REMS technology is the gold standard. It has completely replaced DEXA. It's becoming more common in the US. There's many more clinics that are utilizing REMS. A lot of them are utilizing both so that then we can still get the gold standard DEXA and then we compare to the REMS. The most exciting part with the REMS is that it gives us the bone quality as well, which gives us a much better picture of total bone strength and fracture prevention or fracture risk. But probably the most exciting part of REMS is you don't have to wait 2 to 3 years.
Sure.
So anytime you do an intervention, whatever that may be, whether it's starting up an exercise program, cleaning up your nutrition, being more physically active, going onto medications, making other lifestyle changes, hopefully it's multifactorial. But one of the biggest challenges is how do you know if it's working, right? And with traditional DEXA scans, you have to wait 2 to 3 years to know if it's working. If it isn't working, of course, the biggest risk with that is that you're getting worse, and then it's going to be that much harder to recover. So REMS allows us to rescan more frequently, so we can be, yay, it's working, keep going, or add a little bit more, or let's just change this one little thing. Or we can be like, you know what, it isn't working, we need to add some more things, or we're obviously missing a piece of the puzzle here. So
We've hosted some REMS
Yes.
at our wellness center, and we've had some people rescan. It was very interesting because we were able to do the deep dive because we could see like in 10 months maybe she had a huge decrease.
Yes.
And it was alarming, to be honest, but it was really...
Why are we getting worse?
Right, but it was super empowering, and we were able to do a deep dive to help her figure out what was going on. And it's so good to be able to have that data and that information and not have to wait 2 more years, because it would have been significantly worse if she would have continued down that path.
Absolutely, we were able to intervene much more quickly.
Yeah. I mean,
but one thing, go ahead.
Oh, sorry. I was just going to say, also the same way is that we've also been able to celebrate, right? We can say, yep, that supplement we're doing, what we're doing exercise and movement-wise, the other lifestyle factors, reducing stress, we can see that improvement.
Yeah, for sure.
And that just feels so much more rewarding when you know I'm doing all the things I can and it's paying off.
Absolutely. And then the other thing, just always keep in mind, going back to the REMS, if you do have a decrease or if you do a REMS scan and 6 months later, 10 months later, or a year later, either your bone density has decreased or your bone quality seems like it's decreasing, one thing always to keep in mind is that bone remodeling is very slow. It's one of the slowest systems in the body to have an improvement or show a decline in. Sometimes, especially if the issue was that you were clearing out old bone too rapidly or you just weren't stimulating enough new bone tissue, sometimes the bone loss or the loss of quality that we're looking at is actually because we're starting to make a change and the body's literally clearing out old garbage. And that's what we're seeing. It's not necessarily bad. It's just that we're actually legitimately seeing bone remodeling taking place, which is super exciting.
That is exciting. So we didn't really talk about this last episode, and we probably should have, because we talked a little bit about the bone. We get new bone about, what, is it every 7 to 10 years?
But every 7 to 10 years, we have a whole new skeleton. How cool is that?
That means that everything we're doing today is just going to help us age that much better.
Yes. And or not.
Or not. Yeah.
If you're not taking care of yourself, right? You're just not going to tell a good story in 7 to 10 years.
Yeah, this is true.
So, yes.
Yeah. Okay, friends, it's now time for our KISS action item for the week.
So let's just keep it simple. If you're getting a bone scan, ask this question. What exactly is this scan measuring? Density or quality 2? And if you've had a DEXA, just take a peek at your T-scores in both hips and in your spine. If you are interested in learning more about REMS or the EchoLight technology to get a little bit better picture of your bone health, you can find locations and more information on echolightmedical.com. Just a caveat with that, the main website is in Italian because, like I said, it's more common over in the European nations, but there's a little area on the website where you can translate it into English. So take a look at that.
Okay. So what is the bottom line here?
So the bottom line really is DEXA is still the gold standard, and that is what your medical providers probably are going to be the most familiar with and be willing to have conversations about. But it doesn't tell the whole story, and your provider is going to know that as well. REMS is up-and-coming technology. It's becoming much more common in the U.S. and provides just more valuable information so that you get more full circle information about your overall bone health. And it's giving fuller, faster, and more reliable view of how your bones are really doing in real time.
And for anyone who wants to go deeper, we've put together a free cheat sheet comparing DEXA versus REMS with what each of the tests includes, what it misses, and when to ask for it and when.
You'll find the download link in our show notes and in the description of the YouTube video for you to take a look at that and have that information at your fingertips.
Next week, we're going to be talking about T-scores, which we've alluded to the last couple of episodes. We're going to talk about what a T-score is, what they mean, what it measures.
I'm really excited for that episode because I think T-scores are just so confusing to so many people. And that's probably one of the biggest questions that we get, especially when it regards to bone health, DEXAs and all that stuff. But what do you do with this random T-score?
With this random number? What does it actually mean? So say yes to better bones and say yes to chocolate.
See you next time.
Thanks for hanging out with us on Say Yes to Chocolate.
If today's episode gave you a win, something to think about, or even just a smile, we'd love it if you'd subscribe, rate, and share it with a friend.
Want more? Join our email newsletter so you don't miss a beat, and come find us on all the social channels at Say Yes to Chocolate Podcast for all the quick hints and tips.
And don't forget, you can always send us your questions or episode ideas. We love hearing from you.
Until next time, keep